We found in our study that the Choosing Wisely guidelines that identify low-value surgical practices are not uniformly successful in de-implementing practice in breast cancer treatment. We looked specifically at two practices, the use of sentinel lymph node biopsy in patients over 70, as well as contralateral prophylactic mastectomy, and found that neither of those practices were eradicated by the guideline dissemination. And it's really unclear why this might be and why we continue these practices although the data doesn't support their use. Among surgeons, there's a lot of attention being paid toward low-value practices as we try to scale back. In recent years, all of the paradigm shifting around early-stage cancer diagnoses is often in doing less, especially in breast cancer. We find ourselves being pushed to do less by our data, less chemotherapy, less axillary lymph node surgery, less definitive mastectomy, and that's because our adjunct therapies are being proven to be more effective than maybe we initially thought, or maybe we didn't really appreciate. And so in this arena, in this space, we're trying to figure out what the high-value practices are for our patients so we're not exposing them to unnecessary harm.